And if I can have everybody silence their phones, please. And we have some people in the audience. Maybe we should find out who they are. Can you introduce yourselves, please?
Jerry Van Thompson, Colorado Union Senate.
Okay.
Sue Gold, County Commissioner.
Darlene Ashdown, Brookings.
Sue Curtis, Brookings.
Catherine Wiley, South Prairie Healthcare Alliance.
Maggie Runyon, Brookings.
Lori
Tony.
Stoddard, KCIW.
Tony Stoddard, KCIW.
Okay, thank you. Okay, let's get back to our session. We're done with the executive session, and Ginny's on for operations report.
Yeah, so the first topic that I wanted to share in front of the public is that, and we'll preface this, back in November of 2017, some members that are in the audience today and myself on a phone call with CMS and other agencies, and we were notified at that time of CMS's intent to send us a letter within the first calendar quarter of the year, so between January and the end of March, essentially notifying us that we were going to be, we were under our critical access hospital certification cycle, and that according to CMS, we did not meet the distance requirements of being a certified critical access hospital. I respectfully asked that those present not run with that information and not, wave big banners, because oftentimes CMS says things and things change. And so I really wanted to respectfully wait to see what would happen. On April 3rd, we did receive that letter from CMS notifying us of their intent to decertify us as a critical access hospital effective April 2nd or 3rd of 2019. So they're putting us on a year's notice. In that letter also, they are clear that Prairie Health Network would have the burden to either prove that it is considered a necessary provider by the state of Oregon, and the authority that determines what hospitals are considered necessary providers under the state's criteria is the Office of Rural Health. And they also provide for Prairie Health Network to actually appeal CMS's initial decision through the federal court system. And so Prairie Health Network, as early as November, began working with the Oregon Health Authority, the Rural Office of Rural Health, the Governor's Office, and the Oregon Association for Hospitals and Health Systems to understand what evidence that we might have to be able to demonstrate that we, in fact, are a necessary provider for this county. And we have all of those supporting documents. And we are prepared to provide that to the regional office. And we are also prepared to appeal CMS's decision based on a number of items that, while the regulations say one thing, it is our belief that CMS is interpreting those regulations differently than what is stated, specifically related to the provider-based clinics that are located in Brookings. One is owned by Sutter and one is owned by Prairie Health Network. Because those two clinics are within 35 miles of each other's hospital, CMS's interpretation is you don't meet the mileage requirements of the 35-mile distance. I had a lot of discussion with the attorneys about crossing state lines, and that, if those clinics didn't exist or healthcare was somehow ratcheted back here because of that, the impact that would have, CMS, according to the attorney, really doesn't care about that. They're just here to enforce the laws of their requirements and or the criteria by which Oregon Office of Rural Health is determined to be a necessary provider. So we're going through the process. We'll file the appeal and we'll provide the evidence that we have that suggests we are a necessary provider. If CMS determines that we agree you're a necessary provider, this all goes away. If they don't, we start entering into the federal appeal process. And I'm being told by an attorney that that can be a protracted, long series of events, and that it would not likely get resolved within 1 year's period of time.
In the meantime, your cost status would remain intact.
Correct. Our cost status remains intact until the appeal is finalized in a federal judge determines.
So you can have your appeal process, your first round could take 6 or 8 months, and then you have another appeal, that could take another 2 or 3 years, and you might have a year at the end of that.
Correct.
So you might be 4 or 5 years out.
This really is, we are interesting. I might add that, you know, this is not a Curry Health Network issue. This is going on across the country. In 2013, the Office of Inspector General audited CMS to see if they were following their own regulations about critical access hospitals and the distance requirement. They found a number of critical access hospitals that didn't. They put forward a letter and recommendations to CMS. And one of the recommendations was that as these hospitals go through their recertification cycle, which we're in, that they would have to be able to demonstrate that they meet those requirements. And that is really what tipped this over. It was not phone calls, it was not concerns, it was, we're in our recertification cycle. Every critical access hospital in the country will go through this. Obviously, if CMS determines that they meet the requirements or they're a necessary provider, they're not going to get a letter like we did. Only those hospitals that CMS deems we don't meet those requirements and/or we're not a necessary provider will receive those letters. So this is really on a national level, and I'm really pleased to say that the Office of Rural Health, the Oregon Health Authority, the hospital associations, both here in Oregon and nationally, recognize that this is potentially could have a very large impact on a number of critical access hospitals in the country. That number I don't have right now in front of me. The hospital association is working to better understand that.
Okay. Next on your list is your CEO monitoring report schedule.
Could I make a comment?
In just a minute. Hold on to it, we're almost there.
This is tied to another topic on there. The next board meeting is on April 26th. I've got, I think, 4 monitoring reports that are due. 5.
Jeez.
And there's an outside chance that unless we move the meeting, which I'm not going to recommend, there's an outside chance I may not be physically present here because I'm going to be required to be in Portland that week. So I would like permission from the board to not focus all my time writing reports in the next couple of weeks. I've got a lot going on, and I'm going to try to get as many of them done as I can, but that's an opportunity for us to talk about my performance as it would relate to those reports. And it may be meaningful for you to get them, to read them in advance, but I would respectfully request that at the next meeting, unless I can be present, that I'll get you what I can to talk about at the future meetings, but that may not be agendized to discuss in my absence.
Does that need a vote?
I don't know, I would just like to gain consensus and have that. I didn't put it down as
I think that's,
I
just move it. Just move it to May.
We could move it to May. I'm still going to start working on it because then I got 6 due in May. and it
Well,
doesn't
you know,
get any
as
easier,
you
but-
finish them, get them to us, then it'll just
Okay.
give us that much more time to review them.
Great,
Yeah.
Perfect.
Where you're at.
all right, that works for me, very
You guys
good.
think that's okay? Yes.
All right,
Okay.
all right.
But we're going to keep the meeting as is.
My preference, that's coming up for you guys to discuss.
20.
You're out of order.
Oh, yeah, I'm out of order. That's okay. Okay. Now we have citizen input.
Yes.
The clinics in the hospital are absolutely necessary. We have many, many people on the coast. My problem is, they're not even coming close to meeting the need. I finally found a decent doctor after 13.5 years here, Dr. Collier, who was allowed to leave when Werman came back early. There was a problem with my heart. There were tests done. The results would have been back 2 weeks ago. I don't know what's happening. I simply have been put into limbo with no doctor.
Would you do me a favor before we leave? Can I get your name and number so I can have somebody follow
And
up
there's
with
a
you?
whole lot of other stuff
Yes.
in terms of need. A lot.
Well, I just want to get your contact information so I can pass it on.
Okay?
Get them in touch to make sure that we get you seen as soon as possible. And we do have provisions to make sure that folks like yourself are not just hanging out in limbo. So,
Well, I've just been stuck there and the quality of the medical has sucked, to put it bluntly. I mean, I was talking to the ladies earlier. when I had been physically assaulted, wanted a mild time-release painkiller. I didn't want to be turned into a zombie. Took a pill without looking at the bottle. When it took effect, I ran and got the bottle. The doctor had given me oxycodone. And that's only one. There's a long, long string of, and I had a great doctor in California, and I've had good doctors elsewhere. This place is a disaster. I'm sorry. I mean, unbelievable. I filed a complaint against a nurse practitioner. Found out 2 months later, that's all I'd done was file a complaint. Never went anywhere.
What's our quality person's name?
Gail Menninger.
Did you talk to Gail Menninger?
Yeah.
Okay.
And I talked to her, now it's been months ago, and I haven't heard about what happened to the complaint.
Okay.
I mean, this is par for the course. When I had an injury, and that's rather obviously not just arthritis. I have minor arthritis. The doctor said I might lose my finger. That was Utterback. When he wrote it up arthritis. Means I don't get a settlement. And my hands are now painful because I can no longer do the handwork that I did every day. That is minor arthritis and the result of a badly healed injury. And Utterback went. And on and on and on. And
Yeah, we'll definitely follow up on that. And we're glad you're here because we don't hear these things, we can't follow up. So we appreciate that.
okay.
And hopefully Jenny or somebody will get back to you on the follow-up, right?
Definitely. Well, I won't be the one, but I will make sure.
But
Yes.
really sorry to hear you've had such a bad experience. It's not what we want.
No. I
So we-
mean, medical, it's gotta be good, and it's gotta be numerically available. There are plenty of people that can't find a doctor.
Yeah, it's a problem, we know that. There's not enough providers.
I know we're working
on
on it. You know, we do have two, Dr. Sparling will be joining the network May 1st.
Is that in Gold Beach?
Yes, that'll be in Gold Beach.
Family practitioner?
Family practice, yep.
I wish you could get Collier back. That's the first good doctor I've run into in
Was
years.
that the traveler?
Yeah, she's a
Yeah.
local, so she's staying in any one place, that's what she does, she works and goes place to place.
Yes.
I wish you could have spent her 6 months here instead of leaving after a couple of weeks, or a month, I guess.
No, she was here for 3 months, almost 4 months. And then Dr. Lauder I met with her over the weekend, she'll be coming, and she too will be an excellent physician. I know that North Bend Medical Center, not us, but they are actively recruiting in another family practice that'll do OB. She's very well trained as well, and I'm hopeful. I have a phone call scheduled with her tomorrow morning, so.
You don't know.
No, I
We
don't,
don't
it's
need
not my
to- I know,
recruit,
I know,
it's
yeah.
just really to answer questions about Gold Beach Healthcare, but we are aware, and I would agree with you, I grew up as a pharmacist, I understand how important quality is. Good physicians.
You die without it.
We all do.
Just
No,
that simple.
exactly. And as you know, when you're doing it for yourself, you know, I always tell people this, is that you have to be your own advocate.
Oh, yeah.
Because people get busy and things happen and I people like you have to keep reminding people that it's not okay. Or you have to take care of yourself.
Oh, yeah.
Okay, let's see, any other comments? Catherine?
Yeah, Catherine Wiley, South Curry Healthcare Alliance. I just wanted to make a couple of comments and about our role in this and so forth, as well as other individuals regarding the alliance. The South Curry Healthcare Alliance began after the issue of the annexation of 97415 and looking at the pros and cons of not just what was viewed as best for South Curry, but also potentially what could be of benefit to the Curry Health Network. And so the thing that we were looking at, and we actually met with Ginny on May the 5th last year, was the potential of a satellite hospital. We had looked at and had communications with Region 10 CMS, and satellite hospitals are totally legal. It maintains 4 critical access hospital bases. The maximum of med-surg beds basically as 25, but it also would allow for this facility, being as large as it is, to have the potential for having a rehab unit as well as a psychiatric unit, if that were a decision of the board to do. We followed that up with coordinating a public workshop in August of 2017, and there appeared to still be a big push for an emergency room only. By that time, CMS has indicated, and it's in writing, and as Ginny said, some of what CMS says gets corrected down the line. But at the time, what they stated unequivocally was, while freestanding emergency rooms are legal, they are frowned upon. And the reason that CMS frowns upon freestanding emergency rooms is because of the cost factor in double transportation, which more often happens with a freestanding emergency room, as well as increased risk factor in delayed care because of double or triple thing. And again, that's from them. But what we felt was, if the beds could be split, since this one was built for 17 beds, there's still 8 beds legal, and whether or not you want to cut back on that. So we met again to try to clarify, as Ginny indicated, in November 20th. That meeting on November 20th is recorded, and what Ginny asked us to do was not say anything until the next board meeting, which was November 29th. In fact, we really haven't gone public with anything. We never planned on waving any banners or anything like that. This isn't about that. This is about trying to have a county that has quality, comprehensive, and cost-effective health care for all of us. And the benefit of having a satellite hospital there, in our perception, of course, you'd have to do some feasibility studies, but the cost effectiveness with having the added reimbursement, because as a satellite, it already is a satellite of your facility. It's being billed under this hospital license. So it is a critical access hospital satellite. And there are thousands of them throughout the country that have multiple satellites. Everything from laboratories to imagery and so forth as satellites, not within the facility itself. And it's all public on the information. So I think we were as shocked as Ginny was when the announcement was made by CMS. They included a gentleman named Stephen Chickering, who actually is over Region 8, 9, and 10. So this was not just a Region 10 issue with Julius, the gentleman up in Seattle. Our understanding, and I will speak for our group, was that the regulations relating to critical access hospitals meant that you could not be within 35 miles of another critical access hospital. And that is what we understood. It also was one of the reasons that some of us, including myself, fought Sutter Health from becoming a critical access hospital. And we have been very involved with Dr. Duncan and the tribal entities, the Indian Healthcare out of Arcata was adamantly opposed and wrote letters in opposition to Sutter becoming a critical access hospital. So when that has been put off and so forth, this is something that none of us ever imagined. And I just wanted that to be part of the record because, and at the time of the meeting in November, we asked Ginny how we could all come together and work together to support what we all need. So I wanted to be very clear, since this has now been brought up publicly by the federal government and so forth, what our position is and what our interests are. So,
Thank you.
you're welcome.
So we need all the support we can get from all that. Helpful. Thank you. Okay, anybody else have any more comments? Okay, now we're on board schedule. Sorry.
Can I just ask you a quick question? When is the next county commissioner meeting?
It's the 18th of April.
April. Is there any way that I can get on that agenda to share this at that meeting?
Actually, that would be a good thing. Call John Jesuit at the county
Okay.
and tell him you want to get on, or John Hitt, he's kind of in charge of the agenda right
Okay.
now.
Perfect, thank you.
You're welcome.
Anything else? So are we going to stick to the April 26th date? Is that the decision?
I'd just like to throw this out
Oh.
in comment. Jenny is the one that does a tremendous amount of work preparing for these board meetings and show. I'm just wondering, you know, our requirement is we meet once a month. We're meeting here today. With all the stuff that's on everybody's plate.
Yeah?
Stay underneath the rules here. With all the stuff that's going on, it seems like maybe we could focus on a meeting in May as opposed to having a meeting here that has to be prepared. Although, you know, we do have the financial stuff to Carl, and maybe some other business.
Yeah, that's what I was gonna say, is that, you know, the preliminary financials for March are extraordinary, and I would not want to take that opportunity to share that.
So clean out the monitoring stuff and the stuff that takes time to prepare, could be done in a month.
Yep.
Take that out, let's just do the nuts and bolts and.
So you were talking about bringing the community needs assessment, can that wait until
That's
May?
gonna, yep, that's gonna have to wait.
Okay,
Yep,
okay.
that has to wait, strategic plan, I mean, there are just some things right now. We
Yeah.
just need to, I'm just gonna be pressed with time.
So what you're saying, Bo, is maybe have a meeting that just focus on the
Right,
financials?
let's go ahead and do the meeting on the 26th like the schedule has, but the instructions to Judy and to Cheryl, you know, are to scale it down. Won't put a whole bunch of work in this thing because every minute counts. So every distraction
Time
we
counts,
have whatever the distractions are, every distraction takes away from some really important things that are going on right now. I just don't see it being wise to moving the furniture around when we should be.
You know, between Erdman and CMS, that's where all the energy needs to go right now.
Absolutely.
So,
That sounds good. I don't think we need to vote on that, do we? Okay. Okay, then, appreciate everybody coming today and.
Thank you for making the treacherous drive up.
Yeah, exactly.
Well, we didn't know it was treacherous, we did that.
I know.
It was not treacherous in Brookings.